Okay. Hi everyone. So today we're going to talk about Title X and reproductive rights. So this was from the Public Health Service Act, and I'm going to look at this specifically through a reproductive justice lens and go into a little bit about how the policy supports and also falls short of meeting people's needs, specifically marginalized people. Um, it was passed in 1970. And as far as I could tell, it's the only federal program right now dedicated solely to providing family planning and preventative health services. It was created to aim, um, with an aim to help low income and uninsured individuals access like contraception, STI, cancer screenings, but most notably, um, not abortion. And so let's talk about some of the gaps and the strengths of Title X. Um, as I mentioned, they don't fund abortion services, and personally, I think that's a gap in the policy, especially post Roe v. Wade getting removed several years ago. Now everything is decided for abortions at the state level. Um, and so something like Title X is actually even more important now. Another gap is the inconsistent funding and lack of funding across the states. It's also not a policy that it specifically addresses some of the issues that affect marginalized people, like transportation, language, or childcare barriers. So it's kind of like it was created um, to help marginalized communities, but it doesn't really answer any of the questions that the gaps in the policy bring up. So that's definitely room for improvement. Um, but we should definitely note the strengths. It is not something that I think should just be completely scrapped. I think that because it's helped so many people access some essential health services, especially in those rural areas, it can serve as a foundation for something better. And so, yeah, I think that's definitely a strength for it, just existing. Unfortunately, it is prone to a lot of political whiplash. So, depending on who the current administration is, Title X gets like whipped around. For example, in 2019, the Trump administration issued what's called a gag rule, which means that not only can um, clinics under Title X funding not perform abortions, which has always been the case, but it also stopped allowing them to even refer patients for abortions, which then caused a lot of clinics to exit the Title X locations, like Planned Parenthood was one of the big ones that did that. And even though that was reversed in 2021 by the Biden administration, a lot of communities still haven't recovered from that mass exit. Um, and again, especially people in marginalized, dominated spaces. Um, so looking at this from a reproductive justice lens, I think just means that we need to be asking who has the power to decide if, when, and how they want to have children, and who has access to the resources that they need to raise families in safe and supportive environments. Um, Title X, just as it exists right now, does not answer those questions fully for marginalized communities. So, what do I think needs to change? Um, Abortions should be treated as basic healthcare for everyone across the board in all the states. And so that means it should be included in Title X. Um, the program itself just needs more funding, especially consistent funding in places that are rural and underserved. Maybe it could support community-led organizations that already work to provide culturally responsive care. And as social workers, we can push for these changes through policy, work, and advocacy. Um, yeah. If anyone has any questions, comments, this is something I'm very passionate about. So I'd love to talk to anyone about it. And pardon my awkwardness ending this.